A patient today asked me about the side effects of antidepressants. There are a lot of different types of antidepressants, and so we talked about SSRIs first, which are selective serotonin reuptake inhibitors, one of the most commonly prescribed classes of antidepressants. We talked about the fact that when you start these medications, individuals might feel different side effects that tend to be pretty transient. Examples would be upset stomach, headache, feeling a little bit, maybe a little bit dizzy or just a little bit different, some difficulties with sleep. Some individuals get something called activation, where there's a little bit of a burst of energy when they take it, for the first couple of days that they take one of these medications. That can actually feel like increased anxiety, even though for a lot of people these medications will treat anxiety. A lot of these side effects are transient, so after 3 or 4 days or a week or a couple of weeks, they tend to go away. And so sometimes a patient will say, hey doc, I'm having a headache since I started this medication. I think I'm going to go ahead and stop it. I'll say, well, if it's not too severe, if it's tolerable, you can hang in there a couple more days. There's a good chance that it'll go away. Some other side effects, some individuals will have some nausea with these medications when they first start. Again, that usually goes away. Some individuals, some difficulty with sleep. A little bit of a dry mouth or constipation can be pretty common. With SSRIs, they don't tend to be a reason why people stop the medications, but sometimes people end up needing to use a little bit of sugar-free gum or candy, and that can really help with that dry mouth, for example, or stool softener, obviously, for the constipation. It's not uncommon for someone to say that it will affect their libido or their sexual life in some way. For men, this side effect tends to be that the medication actually causes it to take longer for them to climax if engaged in sexual activity. And SSRIs like Prozac and Paxil and Zoloft are actually a form of treatment for premature ejaculation for men. And so probably about half of the men that take these medications will say that they get that side effect, and about half of those individuals will say that it's a good side effect. And obviously a lower libido or difficulty reaching orgasm tend to be a problem universally if women get those side effects. But again, for a lot of people, they don't actually have it. And it is dose dependent. So sometimes someone may have that side effect because they're on a little bit too high of a dose, and a little bit of a lower dose won't cause it to be much of a problem, or it won't be a problem. And that dose will still really help them with their symptoms. There are other side effects, obviously, and there's even a black box warning for suicidality with SSRIs. And so it's just incredibly important that if someone starts a medication like an SSRI and they have any suicidal thoughts or any concerns that they're in danger of harming themselves, that they seek immediate medical attention. Please remember that anxiety, mood disorders, and depression are treatable medical illnesses, and if you do need help, don't hesitate to reach out and make sure that you get it.